is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Your health is one of the most important things in life. It affects your physical, mental, and emotional well-being. All of us are aiming health, but still, the anomalies, the complications, and defects are still not inevitable.
Good day mga kanars! I am Melanie Rojas Leones, a second-year student nurse at Davao Oriental State University. And now, I am going to present in detail the topic about Ankyloglossia and the Thyroglossal duct cyst. So here's the overview of the topic. The definition of Ankyloglossia, the causes of Ankyloglossia, the sign and symptoms, the treatment, and also the definition of Thyroglossal duct cyst, the causes of Thyroglossal duct cyst, and the management and the treatment. So mga kanars, just tune in and please watch this video till end. Enjoy watching! So what is Ankyloglossia? The common term for Ankyloglossia is the tongue tie. In this condition, the tongue is literally tied or tethered on the floor of the mouth, sometimes inhibiting both speech and eating. A child is born with this condition. Tongue tie is common, affecting nearly 5% of all newborns. It is 3 times more common among boys than girls and frequently runs in families. Research has shown that a significant number of infants with breastfeeding problems have tongue tie, and that, when corrected, these problems may be eliminated. A provider cannot always predict, however, whether a mild case of tongue tie might lead to speech problem, so surgical intervention is not always necessary. Now, we were going to talk about the causes of Ankyloglossia. Tongue tie occurs when the frenulum, the band of the tissue under the tongue, fails to separate from the tongue before birth. This may be caused by genetics. The band stays connected as the child grows because it's unusually short or thick, creating a tightness to the tongue that limits its mobility. Now, we are here in the signs and symptoms. Children are born with this condition, but depending on its severity, tongue tie can have a range of effects that are noticeable at different times. Here are the most common signs and symptoms. A newborn who has a trouble latching on or sucking from the breast. The infant might chew instead of suck. Tongue tie possess less of a problem with bottle feeding. Enunciation problems that continue after age 3, especially when articulating these sounds, such as t, t, d, d, r, r, d, d, s, s, and z, z. Difficulty chewing age-appropriate solid foods, gagging or choking on foods, pocketing food or withholding it on the cheeks, and persistent dribbling. Now we are here in a treatment. While some providers take a watchful waiting approach to see if tongue tie might go away in milder cases, others increasingly recommend a prompt treatment approach to prevent continuous feeding difficulties in an infant or in an older child, more subtle speech difficulties, dental problems, and associated social anxieties. Most cases of tongue tie are treated as soon as they are diagnosed, and depending on the child's age, it can be done either in office or in operating room. Tongue tie can be corrected in one of two simple ways, such as frenotomy. This can often be done in the ENT's office if tongue tie is discovered in a newborn. The physician examines the frenulum and then snips it free with sterile scissors. The procedure is quick and usually bloodless. Second way of treatment is called as frenuloplasty. If the frenulum is too thick for a frenotomy, a slightly more extensive procedure called as frenuloplasty may be recommended. This procedure uses general anesthesia and surgical tools to free the tongue from the thick band or several bands tied to it. The wound is closed with stitches that absorb on their own within a couple of weeks. Your child will go home in the same day as the operation and will most likely not need to stay in the hospital overnight. Possible complications of a frenuloplasty are rare and include bleeding, infection, scarring, or damage to the tongue or salivary gland. What are thyroglossal duct cysts or TDC? Some people are born with small soft lumps in the middle of their throats. These lumps, which can be felt and seen, are called thyroglossal duct cysts or TDC. These cysts are small, typically measuring about 2 centimeters around. Now we are here in symptoms and causes. For the symptoms, thyroglossal duct cyst can be felt through your skin. This cyst can swell and hurt if you and your child develops an upper respiratory tract infection that spreads to the cyst. This cyst can make it hard to swallow food or liquids. A noticeable lump in the front of your throat that appears to be getting larger. A noticeable lump in the front of your throat that feels hard, and swollen lymph nodes. In causes, these cysts develop during gestation when your body begins building your thyroid gland. To build the gland, thyroid cells travel from the base of your tongue to your hyoid bone. This U-shaped bone that supports your tongue. Thyroid cells make that journey through what is called the thyroglossal tract. And now, we're here in the management and treatment. So there's a question. Does the thyroglossal duct cyst need to be removed? The answer is your healthcare provider may recommend surgery to remove the cyst if it's infected or it makes it hard for you or your child to swallow food or liquid. They may also recommend surgery even if your cyst doesn't have symptoms. What surgery removes thyroglossal duct cyst? The most common surgery is a procedure called cyst trunk surgery. To do this surgery, healthcare providers make an incision in you or your child's throat so that they can remove the cyst, any remaining thyroglossal tract in the middle of you or your child's hyoid bone. How do healthcare providers treat thyroglossal duct cyst cancer? If you have TDC cancer, healthcare providers may recommend you to have a cyst trunk procedure, followed by a check of your lateral neck lymph nodes and your thyroid, depending on what they find. They may recommend additional surgery such as total thyroidectomy. Healthcare providers remove all or your part of your thyroid gland. The lateral neck dissection. The healthcare providers remove all lymph nodes in your neck that may be affected by your cyst. The last is the radioactive iodine treatment or the RAI. This treatment involves taking pills containing radioactive iodine to kill any remaining cancer cells. And that's the end of our discussion for today, specifically about the topic of Ankyloglossia and Thyroglossal duct cyst. Abnormalities, defects, and complications may not be inevitable, but still, there are things we can do to help reduce the risk of your baby having a birth defect and increase your chances of having a healthy baby. By research continues into the causes of birth defects and ways to diagnose, prevent, and treat them. Some new developments in testing can give a diagnosis at an early stage of pregnancy. Gene therapy is developing as a way to fight or prevent genetic illnesses. Prevention is always the best choice rather than a surgery, treatment, and cure for a healthier, happier, and an optimistic life. I hope you guys, mga Conors, are fueled with knowledge from this video. And again, this is SN Mel saying, let's continue to lit our lamp to radiate and raise warmth to people's life. So don't forget to like, subscribe, and share this video. Bye! Enunciation problems that continue after age 3, especially when articulating these sounds. D, as the frenuloplasty. Dapat, ay, naunsa man yung naman.